Hi, this is Dr. Toby, your host on Health and Wellness. Thank you for joining us. We're going to have a great time with Dr. Monda Monga. Dr. Monga is a graduate of the Tougaloo College. She has a bachelor's in business administration, got a master's in public health from the Jackson State University, and then a PhD in leadership development in education, also from Jackson State University. She's a former chief operating officer of the Brothers Keeper organization that spearheaded since 1999 the caretaking of positive HIV individuals in the state of Mississippi. She's now working in the University of Mississippi Medical Center as the assistant professor in population health. And she's been a recipient of several grants numbering more than $7 million. She's going to talk about her faith, her future, and her fortune, how God has brought her from a blue-collar background where her parents were less than educated to the point where she and her sister are now multiple degree holders. You do not want to miss her story. Don't forget, Jesus is Lord. God bless you. Hi, this is Toby Moma, your host on Health and Wellness. Thank you for joining us. You just watched the video of our medical missions trips to Boko, Nigeria and Uyo, Nigeria. This year we're going to Kaduna, Nigeria. It's another part in the northern part of Nigeria, which is Muslim dominated. And we're hoping to reach 8,000 souls for the name of Jesus. We're going to give them food, clothes, medicine, water, and we're going to help those who need help. We're going to show the love of Christ to them. And we want you to join us. We want you to support us in your prayers and your finances. You can write to us, P.O. Box 550, West Monroe 71294. We're looking forward to hearing from you. Thank you so much. And today we have a guest with us. Dr. Monga is a well-known public health advocate. She's made her name in the HIV world, and she's a assistant professor, I believe, at the University of Mississippi School of Population Health, and she's been very pivotal in helping to raise the awareness on HIV and some other minority disparities that have affected healthcare in America. So we're so delighted to have Dr. Monga on the show with us today. Thank you so much, Dr. Monga.
Thank you for having me.
Real pleasure. So let's get to know you a little bit. So who is Dr. Monga? I mean, a lot of people know you as the former chief operating officer of
My Brother's Keeper.
My Brother's Keeper.
Mm-hmm.
Now you're assistant professor at the University of Mississippi Medical Center.
Yeah.
Before that, were you in the school system?
So actually, the work I've done in the school system was not directly me being in the school system. It was actually me volunteering and assisting and kind of going back and helping students who were very much like myself. Mm-hmm.
Okay.
So
tell us a bit about you. So who is Dr. Monga?
Well, I am a Mississippi native.
Okay.
I am a 3-time HBCU graduate, first-generation college student. Actually, nobody in my family prior to myself had gone to college. So to have the opportunity to go to college and go all the way through to get a PhD was amazing. I am a mentor. I am a daughter. I am a sister. I am a lover of my community and my people. I'm a lover of Mississippi.
Wow. So three HBCUs. Which HBCUs are you talking
So Tougaloo College, just some
Undergrad.
historical context.
Oh.
Tougaloo College was at one point the most noted school for turning out African American doctors, congressmen, dentists. So the historic,
Scientists,
yes,
yeah.
scientists, absolutely.
Wow.
They would call them on campus Kinchlow kids. And so if you were thinking about going into medical school, Tougaloo was a school that you went to.
Why Kinchlow? What's Kinchlow?
Kinchlow is the science and chemistry hall.
Oh.
And so kids who were biology majors, chemistry majors, or pre-med, those were known as the Kinchlow kids
Oh, wow.
at Tougaloo College. And then a master's in public health from Jackson State University,
Wow.
and then went on and get my PhD from Jackson State in health ed leadership.
Health and leadership. Wow. So let's. When did your passion for HIV get unbridled, if I may use that word? Because that's
Yeah.
what most of us know you for.
Yes.
Okay.
Yes. So, first of all, I'm a believer that God will direct your path. And my path goes all the way back actually to 1994. In 94, my aunt, my mom's baby sister, was diagnosed with HIV.
Oh, wow.
And as a family, we knew nothing about this virus. We knew absolutely nothing about it. And my aunt went into rehab, actually right down the street in Vicksburg, and that's when she found out about her status.
And this was 19.
This was 1994.
When there was very little information.
Very
about
little
HIV.
information, specifically around African Americans. There was not a lot of information around HIV.
So there was a stigma.
And so
there was
the stigma was horrific. Even as a
Wow.
family, our stigma was horrific.
Wow.
That was my first introduction.
And you were in
And
college then, or
I was actually a senior in high school.
high school?
I was
Wow.
a senior in high school. And not knowing that that would be the path. So 2004, there was a book by an author. My sister is an avid reader. And she told me, she said, there's this book, Brothers on the Down Low, by author J.L. King. So she was like, you got to read this book. So I read the book, and I was like, oh, my gosh. Well, here HIV pops up again because here this guy was basically talking about that, he was living a double life. And because of that, he was putting his wife at risk for acquiring HIV. And I thought to myself, my God. And so, again, I'm a believer that God will show you your path. So I read the book. A few weeks later, he's on Oprah. The guy is on Oprah.
And nobody talks about this in the African American community.
Absolutely,
Right.
absolutely. So he's on Oprah, and I'm like, okay. And a few months after that, he comes to Jackson State. Now, at this time, I'm actually working at Jackson State in the purchasing department, working on an MBA, not thinking that this was my path. And when he came to Jackson State, I was so excited. I remember getting there extremely early because I knew what the story had done for me. And I thought, oh, my God, it's going to be so many people. So let me get there early so I can get a good seat. And I remember turning around and realizing the auditorium was almost empty.
Oh, wow.
And I'm saying to myself, I'm like, but everybody should be talking about this, particularly black women around HIV. And that's what led the path. I decided I wanted to go into this field of HIV at that moment.
What was your undergrad at Tougaloo in?
Undergrad at Tougaloo was business administrations.
Really?
Business administrations. And so that's why I was working on an MBA.
Just the natural path.
Just the natural path.
To work in a bank or some government office or some.
Exactly. I told people when I was growing up, the only thing I wanted to do was dress up to go to work. Yeah. I mean, you have to understand, I'm from a very, very blue-collar family. And so I knew nothing about this world of that there was even a public health. The only thing I knew was doctor or nurse, right? So I never knew that there were so many other pieces. Yeah, absolutely, absolutely. Wow. But that's pretty much, that started my journey. And I decided, I was like, this is the work that I want to, devote my life to.
So give us a little background. What's HIV's state like now? I know We have a 2020 goal.
Hmm.
No, wait, 2030
The
goal.
2030 goal to reduce
I
the
know
number of.
President Obama said to get the incidents decreased, and people
Hmm.
should know. I think 90% people should know their status or something like that. So how close are we to making that possible?
I will be honest. So it was actually Trump
Okay.
that came up with this, with the ending the epidemic, right?
The EHE
The
goals.
EHE
Okay.
goals, yes. So under President Obama, a lot of work started around HIV because at one point, living in the United States, if you were a person who was living with HIV, you couldn't enter this country with a known HIV status.
Wow.
So that was some of the things that President Obama did was lifting the HIV ban. There also came the what we know as the National HIV/AIDS strategy. It was actually created under Obama, but it was actually President Trump that came in and said
Implemented.
we need ending the epidemic.
Okay.
And one of, I think, the, as far as this field goes, it was a very groundbreaking push to really address
Hmm.
the HIV epidemic. Um, and then COVID happened.
Oh wow.
There was a significant amount of money pumped into southern states like Mississippi. And when COVID hit, a lot of the work we had done around HIV, unfortunately, because of the closures of clinics, the
Right.
shifting of staff, and COVID put such a burden, which I know you're aware of.
Hmm.
It put such a burden.
People couldn't get their medicines. People were
Absolutely.
sheltered in
Absolutely,
and
absolutely.
not taking
Sheltered
medicine.
in,
Yeah.
not taking medicines, but more importantly, it was such a strain on the public health as well as medical community, because doctors, nurses, I mean, it was all hands on deck for this one thing, and unfortunately, a lot of the work we had done around HIV here in the South actually pivoted, and we lost a lot of ground because of
Wow.
it. Hmm.
So that was so at this current time, 2024. Do you know how much? I don't know if you know the numbers, or
Hmm.
I know Jackson is high, Mississippi is
Hmm.
high.
Hmm.
Are we making progress? Are we
We're
stalling?
Mississippi, and here's why it is so, I would say, dangerous for a state like Mississippi, because prior to COVID, we had about 2.9 million people for the entire state. And when you rank in the top 10 of HIV cases, or when you are the state where a person is more likely to die of HIV than any other state in the country, that's a dire situation. And unfortunately, Mississippi has not gotten much better. Um, the city of Jackson still, again, ranks also in the top 5 when you start to talk about metropolitan areas. And when we think about the city of Jackson, you're talking about a population of 350,000 people, give or take. But more than 80% of the population in Jackson is African American,
Right.
which is really a reflection of what HIV looks like in the state of Mississippi. More than 70% of people diagnosed with HIV in Mississippi are African Americans. So this has really become a cry for help for the African American community. But some of our biggest issues are around stigma, education, quality access. One of the things that I tell people is access to healthcare and access to quality healthcare are two very different
Different
things.
things.
Yeah.
And I mean, we call it health disparities, but I mean, is it anybody's? I mean, how do we frame this? Because somebody will be on the other side. Well, it's
Hmm.
not our fault that 70% of the cases are African American.
Hmm.
Somebody else will say, well, it's due to lack of access to care, lack of
Hmm.
education. So
Hmm.
at some point, you have to take some responsibility for your actions at the
Hmm.
same time,
Hmm.
right?
Hmm.
So as an African American community, how can we, take the bootstraps and take responsibility and say we're going to make a difference in our community by education, and I know we're doing this already, going to the churches,
Hmm.
going to
Hmm.
the football games, talking about HIV
Hmm.
in public. Well, can we do better? Is that something we can do? Safe sex, maybe,
Here's the thing. So research has shown us that the sexual behaviors of African Americans are really not much different
from
than
the
our
rest.
counterparts. But here's the thing: people generally have sex in their community. right, in their own network. So if you think about if a disease like HIV, when we start to think about the state of Mississippi, when we're talking population, African Americans only make up about 35% of the population in Mississippi. So when a issue like HIV enters a small population,
Right.
it doesn't take long for that to multiply,
Multiplying that
right,
population,
into a big issue. And it seems, well, what is this group of people doing differently from others? And the truth of the matter is, the behaviors are not much
Much
different.
different.
We're simply looking at a much smaller population where the disease has had a greater and heavier impact. Now, what can we be doing is absolutely taking personal responsibility.
Right.
So whenever I'm out and I'm educating people in the public, the one thing I tell people is they have to remember that they are the MVP in their own health care, right? And that is also in relationships or whatever situation. You have to see yourself as the MVP. Seeing yourself as the MVP means I'm going to ask questions. I'm going to have a conversation. Do you know your status? When is the last time you were tested? One of the easiest things that I advise people to do is simply know your status.
Right.
If you know your status and you enter into a relationship, whether that is a primary partner or a temporary partner, then simply have the conversation. Hey, this is what my numbers look like. This is what my status is. What is yours?
What is yours?
And if a
Right.
person cannot tell you their status or refuses to go and get tested, then maybe that's not a person you should be giving yourself to.
And that
Whether
might be
it's-
one of the things that come up because maybe less African Americans know their status.
Absolutely.
Maybe less African Americans go to the doctors, get tested.
Right.
Maybe African American men, who are the main demographic,
Absolutely.
don't get those routine tests like the females do with their pap and mammograms.
And here's the thing. So we some of this earnestness has to go on the medical community
Right.
because 2006 the CEC said that HIV screening should be a part of routine care. Unfortunately, we still have people who go in for doctor's appointments and think, and they will say to a physician, hey, test me for everything. And physicians test for everything except for HIV. Right. And so,
I see that every day in my medical residence, and I tell them all the time, it's not because he has high risk. It's because he's sexually active. In fact,
Period.
I tell people, even if they say they're not active right now, if they've been active,
if they have been active, absolutely. And
because there's
so,
more than one way to
but
catch it, right?
exactly. Here's the thing, though. Whenever I'm educating, I ask people 3 questions. Have you ever had sex? And generally, hands go up. Have you ever had unprotected sex? And generally, hands go up. And then I ask, do you have a child that you are the natural or biological mother or father? And hands go up. So by this time, everybody's hand in the room is up. And I asked them, so what did you do differently that kept you from getting HIV? And the room is then quiet because people have a moment to reflect that I honestly did nothing
Did
different.
nothing different.
It was just not me.
Right.
And that's how we start to remove the stigma and perceptions that people have done something dirty or that we have all sinned and fallen short.
I was a doctor in this town, and a woman came to my office, real life story, and she had herpes zoster of the left eye. We call it the Hutchinson sign. And it's pathognomonic because I train in New York. Pathognomonic for HIV. You know, you have to be immunocompromised to have that kind
To
of
have it that bad.
infection. So I did a HIV test. This woman she had had a hysterectomy. She had been to several doctors before me, and it came back positive. This woman was like 60 something,
Right.
maybe 50 something.
Right.
And the crazy thing is that she said in this city, Monroe, Louisiana, that she had been diagnosed with HIV in the prison. But when she came out of the prison, she never mentioned it to a soul.
And they never tested her.
And they never tested her.
Yeah.
She just believed God for her healing. And
Yeah.
God helped her. She never got, except that shingles. She never really She had a hysterectomy.
Yeah.
She never went to get, medical insurance on the basis of her HIV. And when I saw her, I was like, you've been 20 years without treatment and you've survived. I mean, that was such a, but eventually we plugged her in and she got treatment and all that. But just to think about it, that she had been to the doctors, had surgery, had dental work, had eye exam, had colonoscopy, but had never had a HIV test.
No, and so in that case, yes, we can put some responsibility on the public, but the medical community also has to take some responsibility.
But the reason why they didn't do it was, like you said, she came to them and said, I'm not sexually active at the moment, but she had 5 kids.
Yeah. And,
she's
and
like,
here's where
I'm
we
celibate.
have to take the
I don't
social
have
determinants. The social determinants that lead to a person acquiring or even transmitting HIV. It seemed that if it would be just natural practice, a woman with 5 kids, let's just test her to make sure. It seems to me like it should be common medical practice. Yeah.
So I'm happy. I mean, I hope she's alive and doing well.
I'm sure she's doing well. The medications have changed so drastically that it's, in many cases, 1 pill once a day.
Now, I don't want to push you beyond what your scope is, but
sure.
Syphilis has recently been in the news.
Absolutely.
I mean, they said we are seeing the highest rate in the last 50 years.
Yes.
And what do you think is responsible? Are we still talking about the same healthcare disparities, or is it just high-risk sexual behavior? Now, syphilis is strictly sex. It's not IV drugs.
It is strictly
blood
sex.
transfusion.
Yeah.
It's not maternal-fetal.
It's none of those things. It is absolutely strictly sex. In the South as a whole, when you're in states that have not expanded Medicaid, it makes a difference. When you are in states where you don't have comprehensive sex education programs, then yes, people are having sex without any knowledge of how to be careful, how to be safe, how to be protected, or even why are people having sex like this? We're not addressing maybe even some mental health issues where people are victims of abuse or depression or anxiety, and sex may be that thing that just makes them feel better even for the moment. And these are just some examples. And then there are just some people who just are out there just having sex, right? But absolutely, that is the key foundation to why syphilis, we've seen an emergence in syphilis. I'll tell you something that changed in Mississippi a few years back. In the state of Mississippi, this is not the first time we've had a syphilis outbreak. Some years ago, 40 years ago or so, we had a syphilis outbreak similar to what we're seeing now. And the state instituted that in order to get married, you had to be tested for syphilis.
That was like 40 years ago.
Yeah, absolutely. And maybe about 10, 15 years ago, the state decided in order to encourage more people to come to the state and get married, they took that off the plate. And I dare say that may have been part of the reason why people are walking around with syphilis, because we know what syphilis is a silent disease, right? Right. You may get, one little chancre and it clears up and you think, oh, I'm fine. Right. Yeah. You think I'm improving. And so people can literally be walking around with syphilis for years and never know it. And again.
And the people who come to my clinic, I mean, I don't know if you see this, but they're mostly the females.
Absolutely.
They come in with and I'm like, where's the guy?
Right.
I mean, you didn't get this alone.
You didn't get it alone.
I've never seen the guy. It's always the girl.
Yep.
Rash, then they have sores, then they're like, oh my God, I can't believe this.
And so we're seeing an influx of babies being born with syphilis in Mississippi.
Like, don't the guys get treated simultaneously? And I know the Department of Health tries to, catch up with the partners.
No. Oftentimes, so one of the other things we don't talk a whole lot about in public health is survival sex. Women are in relationships where they have very little autonomy. And so I can't really challenge you about using a condom. I can't really challenge you on whether you're out sleeping with me and multiple other women, because you make sure that my children eat, you give me the car that I ride in, you pay the rent on the apartment I live in. And those things make, oftentimes these women, they come in and they're getting treated, but unfortunately they go right back out.
So they call it autonomy.
Right. They don't have autonomy in their relationships. Yeah.
So lack of autonomy in
Yeah,
sex.
yes,
Wow.
and it becomes survival sex.
Mm.
This I'm having sex with this person.
Is it possible to target a specific group without stigmatizing them, like truck drivers, like who else did I talk about? There are certain groups of people
Yes,
that we know
yes,
have a
yes.
high potential
So
for
I
high
think it's not
risk.
about targeting.
It's not about
I think
targeting.
I think we should be focused on is education
Hmm.
and creating low barrier access for
For them to
these
get.
groups to get the testing, to get so like my nonprofit has recently, we've started a home HIV test program,
Okay.
right? Pretty much it's not anonymous, because if a person does report positive, we do under state law have to report it,
Hmm.
but people have the opportunity to test at home. You don't have to come into a clinic. You test. I have a social worker that works with us, so the social worker can reach out and work with this person. We can do it over
Hmm.
protected Zoom. So there are things we can do. So I don't. Let's not use the word target.
So target is not.
Let's focus on,
Hmm.
right, because target sounds like
Of
you've
course, of
done
course,
something.
of
It's
course, right.
right.
So how do we educate more?
What we have to start by working with, I would think, is to work with the companies that employ these people.
Hmm.
And if you can show them how ensuring that your employees are safe and healthy and well, then you end up with a better
Better
employee.
employee.
Yeah,
Yeah.
absolutely. It's really good public health is thinking outside the box. Good
So you go
population
to a
health.
you go to a you go to a gas station on the highway, and
Mhm.
I mean they're selling condoms. I mean,
Yeah.
obviously, for me who came from Africa, that's a lot of difference because we don't see that in Africa.
Yes. Mhm.
But so you wonder, is it because they feel that population are high
Well, they
risk?
know what's
Or
going on. I
okay,
mean, so you do have the what they call it, the oldest profession in the world.
right,
Prostitution is still very real, and I want to be clear: survival sex and prostitution are not the
right.
same thing. But prostitution is still very real. So women know that these men have been out on the road for days or weeks at a time,
Hmm.
and so if I can go and make a quick, $100 off this guy, then yeah,
Right.
absolutely. The thing is that taking a true public health approach would be, if you're selling condoms, then also promote the fact that scan a QR code and you can get a syphilis test, or you can get an HIV test,
Hmm.
because science and technology has come so far that in many cases you can do these
Right.
tests on your own,
On your own.
right? You don't have to be sitting in a clinic,
Hmm.
right?
Dr. Monga has been with us for the last 30 minutes talking about her passion, her unbridled passion for HIV, sexually transmitted disease, and health disparities. Next time, we're going to talk a bit about herself, her personal journey, and her walk to where she's gotten to so far. You don't want to miss it. She's a daughter, she's a sister, she's an advocate. I didn't even know she has an NGO, and she's an assistant professor at the University of Mississippi in the School of Population Health. And I know you will be inspired, you'll be motivated, you'll be provoked to make a change in your own little community, especially wherever you see those healthcare disparities. Look forward to seeing you next week. Don't forget, Jesus is Lord. God bless you.